study was designed to see which had the better progression-free survival. That was the primary endpoint. And specifically, it was actually investigator-assessed progression-free survival was the primary endpoint, and some people get confused over that. And that's the figure that will be updated going forward. Last year at ASCO 2017, we saw that it was clearly a positive study. The hazard ratio with that primary endpoint was 0.47, but the median hadn't been reached. The secondary endpoint, which was independent radiology review, and we know that independent radiology review is always a little bit more pessimistic than the investigators, had actually found a median, and it had shown that the median there was about 24, 25 months. At ASCO 2018, we have more than 20 months follow-up, not on the independent radiology review, but just on the investigator-assessed endpoint, and we can see that the hazard ratio has dropped to 0.43, and the median has now been reached, and it's really quite dramatic. It's 34.8 months. Now, people will say, well, that's just because it's investigator-assessed as opposed to IRC, and certainly that's an issue. We do tend to be more generous as investigators. But I think the other thing is it's during the rather flat part of the PFS curve, so a relatively small number of patients one way or another can shift that median by quite a lot. But it's still a very impressive number, nearly 3 years of control of the disease on average, and I think helps to solidify alectinib as that first-line drug.